Hi, I'm Ken Schultz, a licensed sales representative from Humana, and I'm here to talk with you today about the Humana Choice PPO health plan. Humana Choice PPO is a Medicare Advantage health plan that can help protect you from high out-of-pocket costs. Humana, headquartered in Louisville, Kentucky, is one of the nation's largest publicly traded health benefits companies with 50 years of experience in the health industry. We offer national coverage, providing Medicare plans in 50 states and Puerto Rico. Nearly 4 million Medicare Advantage and standalone prescription drug plan members have chosen Humana. Let's find out why. Here's what we'll cover today. First, I'll give you information on the healthcare reform law and the changes to Medicare. Then we'll talk about choosing a plan. Next, we'll review the Humana Choice PPO plan. And finally, I'll tell you how to enroll. Although we're here today to talk about the Humana Choice PPO health plan, it's important to look at your options and then choose a plan that you're comfortable with. After the presentation, you may still have a few questions, but you'll have an understanding of how a Medicare Advantage plan works, what you need to do to join, and what the Humana plan has to offer. Let's talk about when you can join a plan. There are new dates this year. October 1st through October 14th is pre-enrollment. That's when you should compare the plan options and cost to decide which plan is right for you. You cannot enroll in a plan until October 15th. October 15th through December 7th is called the annual election period, AEP. This is a change as a result of new laws that were recently passed. You have several options to consider during the AEP. You can enroll in a standalone prescription drug plan, or you can enroll in a Medicare Advantage plan that includes a prescription drug benefit. You can also change from one Medicare Advantage plan or prescription drug plan to a different one during this time if you prefer. Your plan selection becomes effective on January 1st, 2012. January 1st through February 14th, 2012 is called the Annual Disenrollment Period, ADP, and this is what you can do during this time. People who already have Medicare Advantage plans can return to original Medicare and enroll in a standalone prescription drug plan. You will no longer be able to switch Medicare Advantage carriers during this time. February 15th through October 14th, 2012 is called lock-in. During this time, you are generally not allowed to make changes unless you move, qualify, or lose eligibility for Medicaid or other special circumstances apply to you. We have all heard about the healthcare reform law. But how will it affect you and your health coverage in 2012? Here are some highlights. One of the big changes has to do with the coverage gap, or donut hole. You may have heard about this from your friends. It used to be that once you reached the donut hole or coverage gap, you were responsible for the entire cost of prescription medicine up until you reached the catastrophic coverage level. Now, the Centers for Medicare and Medicaid Services, also known as CMS, will work with the companies that make prescription medicines to give you nearly a 50% discount when you buy Part D covered brand name remedy medicine. The discount will be done at the point of sale and will not change the way your prescription is paid. People with Medicare who receive a low-income subsidy or are enrolled in an employer-sponsored retiree drug plan, with exception of employer groups with waivers, won't be eligible for this discount. Not all brand name drugs will be covered. The manufacturers must agree with CMS's terms and conditions to contract with Medicare. If the manufacturer doesn't comply, they won't be able to work with Medicare plans. Generic drugs, which are already less expensive, will get 14% coverage during the gap if they have been approved by Medicare. You can get free preventive care services like colorectal cancer screenings and mammograms at no cost to you. You also can get a free annual physical so that your doctor can help you set up a personal prevention plan based on your health needs. Humana plans will cover more than 19 different preventive screenings, including, but not limited to, colorectal, diabetes, glaucoma, cancer, mammogram and prostate, cholesterol, bone mass density, and annual routine physicals. There are several ways to receive your Medicare coverage. So, what are your Medicare options to choose from? Option number 1, Original Medicare. That's one of your choices. If you go that route, you may need to enroll in a separate Medicare Part D prescription drug plan, often called a standalone PDP. That's because Original Medicare doesn't cover prescription drugs. Option number 2, Original Medicare plus a Medigap policy, plus a prescription drug plan. Many people who select Original Medicare purchase Medicare supplemental insurance, a Medigap policy. They want to reduce their financial liability. If they need drug coverage, they add a prescription drug plan too. Or option number 3, Medicare Advantage. On the other hand, you can elect to get your Medicare through Medicare Advantage. With Medicare Advantage plans, you'll get a health plan, drug coverage, and you won't need Medicare supplemental insurance. One plan, one company, easy. What we will discuss today is the Medicare Advantage option. So, what are Medicare Advantage health plans? Medicare Advantage plans are called Medicare Part C. Private insurance companies approved by Medicare provide this coverage. Most have lower out-of-pocket costs than with Original Medicare. Many plans offer health and drug coverage as well as extra benefits. Medicare Advantage plans must offer all benefits of Original Medicare and can include Part D prescription drug coverage. Medicare Advantage plans are not the same as Medicare supplemental insurance, and there's less claims paperwork to file. Remember, when you enroll in a Medicare Advantage plan, you still have Medicare. You don't lose it. You're just choosing to take the Medicare Advantage version of Medicare, the version that's administered by a private company rather than the federal government. Here's something for your peace of mind. Medicare Advantage plans are reviewed and approved annually by the federal government's Center for Medicare and Medicaid Services, CMS. By approving a plan, they're saying that the benefits, in total, are at least as good as Original Medicare benefits. You don't have to worry about being surprised later on. Humana Choice PPO is an approved plan. You may question how Humana can do so much for you without charging more than we do. When you join Humana, the federal agency that runs Medicare, CMS, will pay us a flat monthly amount while you are a member of our Medicare Advantage plan. The money is sent whether you have claims or not. When you have claims for using plan benefits, the claims come to Humana, and we are responsible for paying them. That's what we do with the money we receive. We process and pay your claims and administer the plan. Now, let's talk about the specific plan we're presenting today, the Humana Choice PPO. With the Humana Choice PPO plan, you have a defined network of participating doctors, specialists, hospitals, and other medical service providers. You will not need a referral to see any doctor. That's right, no referral needed. You have the flexibility to use providers who are not part of the network. Out-of-pocket cost may cost more when out-of-network providers are used, except for emergency or urgent care situations. And greater savings may be obtained when network providers are used because the plan pays a larger share of the cost. It's important also to understand that if the PPO plan does not cover prescription drugs, CMS does not allow you to combine a prescription drug plan with it. It's important to pick a plan that best suits your needs. Many people aren't sure how to select the plan that's best for them. Here are a few suggestions. One suggestion is to fill out a suitability assessment form. The second one is to write down answers to these questions. What type of plan do I currently have? What do I like about my coverage? What would I add to my current coverage to make it ideal? Who helps me make decisions about my healthcare coverage? The answers to these questions will leave you feeling much more confident in making your enrollment decision. You may be able to get extra help to pay for your prescription drug premiums and costs. To see if you qualify for getting extra help, call 1-800-MEDICARE. That's 1-800-633-4227. TTY users should call 1-877-486-2048, 24 hours a day, 7 days a week. The Social Security office at 1-800-772-1213 between 7 a.m. and 7 p.m. Monday through Friday. TTY users should call 1-800-325-0778 or your state Medicaid office. Need more assistance? Since this is an overview, I suspect you may have some questions. Here's where to get answers. Your Medicare and You 2012 Handbook, which you should receive in the mail from the Centers for Medicare and Medicaid Services. You can also go to www.medicare.gov. It's the Medicare website and contains a lot of helpful information about Medicare benefits and prescription drug plans. Another contact is your local state health insurance program. You can also talk to the Humana representative that reviews your specific plan benefits today. So, are you eligible for the Humana Choice PPO health plan? It's easy to find out. You must be enrolled in Medicare Part A and Part B through age or disability. To enroll in a Medicare Advantage plan from any insurance company, you must live in an area served by that company. That's what we mean by the plan's service area. To get coverage, you must join a Medicare-approved plan offered by a Medicare-approved organization. Medicare has approved the Humana Choice PPO plan. Federal law will not allow us to accept anyone who has end-stage renal disease, kidney failure, unless you are a member of another health plan offered by the same organization within the same state, or were enrolled in a Medicare Advantage plan which was terminated or discontinued after December 31st, 1998, and this is your first election following that plan termination or discontinuance. But if you are diagnosed with kidney failure after enrolling in our plan, you will be covered by our plan. So, what are the next steps? If you're interested in enrolling today, first you will need to complete an application. The representative with you today will go over the plan benefits and have an application for you. Once you become a Humana member, you will receive your ID card in the mail. You will be asked to complete Humana's health assessment. This assessment will allow you to see if you may qualify for special health programs. You should take full advantage of your plan benefits and extras and attend a member orientation which will help you use your plan and extra services to their full advantage. You can contact Humana or your Humana agent anytime you want if you have questions. Now, let's talk about the specific benefits of the plan. A Humana or authorized sales representative will review the following documents with you: the 2012 Summary of Benefits and the 2012 Drug Formulary. You should also know that the person discussing plan options with you is either employed by or contracted by Humana, and that person may be compensated based on your enrollment in a plan. Thanks so much for your attention. For Humana, I'm Ken Schultz.